Yes.
Hi, my name's Caitlin. I'm going to be your nurse today.
Hi.
Hi. Could you please state your name and date of birth?
Yes, Susie Jones, June 29th, 1980.
Perfect. All right, I'm going to check your wristband. Great, that matches. All right, are you allergic to anything?
Not that I know of.
No? Can you tell me where you are?
I'm in my hospital bed.
And can you tell me the year?
2020.
All right, and can you tell me the day?
Well, I think it's Wednesday.
You're correct. Perfect. All right, so we're just going to do a physical assessment here today, and I'm just going to take a listen to your lungs, your heart, your stomach, and we'll just do a once over, okay?
Sure.
All right, so I'm going to start first with getting your vitals. So I'm just going to raise your bed up to, appropriate height so I'm not bending over. All right, and I'm going to take your temperature. Have you had anything cold or hot to drink recently?
No, not since this morning.
Great. Stick this in your mouth. All right, your temperature is 98.1, which is a normal range of 96.6 to 99.9. And now I'm going to hook you up to this little pulse ox machine. It's going to measure your oxygen saturation in your blood and your pulse. Your fingers are nice and warm, so that's good. All right, so your pulse is 62, which is a normal range of 60 to 100 beats per minute, and your oxygen saturation is 98, which is a normal range of 95% to 100%, so that's great.
Okay.
All right, so now I'm just going to assess your radial pulse here. I'm going to have you cross your arm over your chest. I'm going to listen to this. All right, so for 30 seconds, I counted your radial pulse, so 30 times 2 is 60. Okay, so 64 is your radial pulse, which is in normal range, and then I also counted your respirations, which is 14, which is a normal range of 12 to 20 respirations per minute, so that's great. All right, now I'm going to take your blood pressure. Have you had any coffee? Have you
No, I don't
been
drink.
up and about?
I don't drink caffeine.
No.
I haven't been up since after breakfast.
Do you need to use the restroom?
No, I'm good.
Okay. Do you have an arm that I can't use?
No, they use either arm. Depends on who takes my blood pressure.
All right, perfect. And what's your blood pressure normally?
Oh, well, I think last time maybe I asked about it. It was in the 120s, over in the 80s somewhere.
Okay. All right, so I'll go 20 millimeters. All right. So your blood pressure is 118/60, which is a normal range of 120/80 or less than 120/80. So that's great. All right, so are you in any pain today?
Nope.
So on a scale of 0 to 10, how would you rate your pain?
Well, 0.
Perfect. All right, so now I'm going to start my physical assessment. If you have any pain or questions during it, just please stop me, okay?
Sure.
All right, so now I'm going to assess your strength and your extremities and your range of motion, okay?
Sure.
All right, so I'll have you squeeze my hands here.
Okay.
All right, I'm giving you 5 out of 5 bilaterally, which means on both sides.
Okay.
So that's great strength. Now I'm going to have you flex and extend your arms.
Okay.
And then put them in and out.
That's a workout.
I know, right? Working the shoulders. All right, your arms have great range of motion.
Okay.
Now I'm going to look at your feet here. I'm going to have you push down like you're pushing down on a gas pedal. And then your toes to your nose.
Okay.
All right. I would give them 5 out of 5 strength there bilaterally. That's good. Can you lift your legs off the bed?
Yeah.
Flex and extend.
Mm-hmm.
In and out. Perfect. All right, great range of motion in those legs. I'm going to change my gloves here.
Okay.
All right, so now I'm going to take a look at your hair. I notice equal distribution. Length and color's good. Perfect. Now I'm going to check your eyes. Do you have trouble seeing at all?
No, I don't wear glasses.
All right. All right, so I'm just going to have you focus on an object to the distance, and I'm going to shine this light in your eyes, okay?
Sure.
All right, your pupils constricted 5 to 3 centimeters bilaterally. That's good. Now I'm going to have you take a look at my pen and just keep your eyes on it.
Okay.
Perfect, and your eyes converge, so your pupils were equal, round, and reactive to light and accommodation. That's great. Do you have any trouble hearing?
No,
No hearing aids or anything like that?
no,
Great. I noticed no discharge or redness in your ears. Your nose is symmetrical. Any weird discharge from your nose?
no,
No.
just the usual.
Yeah. Well, your nose looks great. And I'm going to have you open your mouth and say, ah.
Ah.
And stick out your tongue. Perfect. Your gums are pink. You have no lesions on your tongue or your in your gums, so that's good. All right. All right. Now what I'm going to do is I'm going to listen to your lungs, okay?
Sure.
Do you have any trouble breathing?
No.
No? Good. All right, so I'm just going to have you breathe in and out when I tell you to, okay?
Yeah.
Just breathe normally.
Oh, okay.
Yeah. In and out. 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 Perfect. Your lungs sound amazing. Now I'm just going to have you lean forward here and I'm going to listen to the back, okay?
Yes.
All right. In and out. 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 Perfect. I don't know wheezes or crackling. Your lungs sound nice and clear.
Good to know.
Yeah. Let's see. No clubbing on your fingernails or cyanosis. Those are all indicators of a lack of oxygen, so that's good. All right, so now I'm going to take a listen to your heart. Do you ever notice your heart race or palpitating?
No.
No? Okay. Perfect. And this, you can just relax. So I'm going to listen with my diaphragm first.
Okay.
I'm going to listen to your aortic valve, which is the second intercostal space, left sternal border. Then I'm going to take a listen to your pulmonic valve, which is the right the second intercostal space, right sternal border. I'm going to do Erb's point, which is third intercostal space. And then I'm going to do the tricuspid valve, which is fourth intercostal space, left sternal border. And then this is where your heart is, I can hear it the best. And this is the fifth intercostal space, midclavicular line, which is your mitral valve. Your heart sounds great. Now I'm going to take a listen with my bell. This detects any abnormal heart sounds. Same
Okay.
thing. Well, your heart sounds nice and strong.
Good to know.
I know, right? Okay, now I'm gonna take a peek at your pulses here and just kind of assess those. So I'm just gonna go for your carotid pulse here.
Okay.
Perfect, 2+ bilaterally, which means it's normal strength, so that's good. And I'm gonna get the brachial, 2+ bilaterally, radial, 2+ bilaterally. Now I'm just gonna lie you down here.
Okay.
We're gonna look at the femoral, 2+ bilaterally. We're gonna do the popliteal, it's 2+ bilaterally. Posterior tibialis here, 2+ bilaterally, and dorsalis pedis, 2+ bilaterally. Perfect.
All right.
All right. Let's see. I'm just assessing your temperature and for edema in your legs, which I know nothing. Your legs are nice and, normal temperature, no coolness, no swelling. Do you ever get cramping in your calves?
No.
No. Good. And I also know no clubbing on your toes here. Now I'm going to assess for capillary refill to see how good your circulation is, okay? So I'm going to squeeze your toes here. All right, and they refilled in 1 second, so that's within normal range here. And I'm going to change my gloves and wash my hands again. All right, so now I'm gonna do the same thing in your fingers up here. I'm gonna pinch them.
Okay.
All right, 1 second. Perfect. Now I'm gonna see how well hydrated your skin is. So I am just going to pinch the skin right above your clavicle, and it snapped back, so you're well hydrated. That's good. All right, last thing. Now I'm gonna listen to your abdomen, okay?
Sure.
When was the last time you had anything to eat?
This morning at breakfast.
Great. And when was your last bowel movement?
This morning after breakfast.
Nice. And do you have any pain in your abdomen?
No.
No? Great. All right, so now we're just gonna lie flat here.
Okay.
All right, I'm gonna listen here.
Okay.
Listen to your right lower quadrant, your right upper quadrant, your left upper quadrant, and your left lower. Perfect. I heard about 5 clicks in a minute per quadrant, so that's well within normal.
All right.
All right, now I'm gonna just palpate your quadrants, okay, the quadrants of your abdomen.
Okay.
Do you have any pain when I do this?
No.
Good, I note no distension, your tummy's nice and soft. All right, no abnormal masses, that's good. All right, well that concludes my assessment. Do you have any questions for me?
No, I don't have any questions. You were very thorough. Thank you.
Oh, well, thank you. Thank you. Well, thank you for being a sport. Can I get you anything right now?
No, I think I'm going to take a nap.
All right, nap sounds good. All right, well, I'm just going to put your call light in reach here. Going to lower your bed back down, put your rail up. If you need anything, I'm going to check on you in 40 minutes. If you need anything in the meantime, just push your call light and I'll be right in, okay?
Sure.
All right, perfect. Thank you so much.
Thank you.
You're welcome.